Thank you for contacting MedicarePro. My name is Peter Walker and my job is to help you understand your Medicare options. What we will cover in this video. Today we'll talk about Original Medicare and the four parts that make up Original Medicare, namely Part A, Hospital, Part B, Doctor's Expenses, Part C, also known as Medicare Advantage, as well as Part D, Prescription Drug Plans. We'll dig a little deeper into what Medicare covers and what Medicare does not cover. We'll look at Medicare supplements, what they are, what the plans are, and how to compare them. And we'll also take a look at Medicare Advantage and how to compare the plans that are available to you in your area. Finally, we'll look at Part D prescription drug plans and the important enrollment dates to get involved in any one of these. Before we proceed, let me tell you a little bit about MedicarePro, about us. As I said before, my name is Peter Walker. I'm the managing partner. My wife is with me in the company. Her name is Nell Walker. I was born and raised in South Africa in a beautiful city called Cape Town, right on the southern tip of Africa. I moved to the United States in 1985 with my mom and dad, and in 2000, I met my gorgeous wife, Nell, in Los Angeles, and we got married in 2003. We've since had three beautiful children, Lila, who's just turned 15, Maggie, who's 11 but going on 18, and my little boy, Max. Finally got my little boy. He's 9 years old. I've been an independent broker since 2015. In 2017, I joined the Equita Group as National Director for their field. We're a $30 million a year field marketing organization. What that means is we work directly with the insurance companies to help them with their clientele. So when we work with somebody like you, we don't get paid by you, we get paid directly by the insurance company. So you never pay any extra for our services. You just get our expertise year after year. We like to say that you're stuck with us for life when you work with us. I'm currently licensed in 16 states, all throughout the Midwest and East. In 2019, I was awarded Aetna Frontrunner and Humana Elite status, which puts me in the top 3% of agents nationwide. So you can rest assured when you're working with our organization, you can be working with a team that is highly educated, and we stay ahead of the field in what we do. So rest assured we will point you in the right direction and do the best we can for you. Let's talk about a few benefits that you get working with somebody like us. We're a non-biased organization, meaning we're not here to represent a single company and try to force that down your throat. I tell people all the time, Medicare is not a one-size-fits-all scenario. There's so many conditions to cover, and some people want to get a Medicare supplement, some people want to get a Medicare Advantage plan, some people travel all the time, some people sit at home all the time, and it's up to us to help you, guide you, and show you the plans that are going to best suit your lifestyle. I'm a Medicare expert. I've sold thousands of these policies. And I work for you. I don't work for the insurance companies. Our job is to make sure that we review your coverage year after year and make sure that the plans haven't changed and you're still getting the best bang for your buck each and every year. Again, I'll just reiterate this. There's absolutely no cost for my help. We get paid by the insurance companies if you decide to go with one of their plans, and it does not cost you a cent more than you would pay going directly to that insurance company. So you can get all our non-biased expertise at the cost of absolutely nothing. Let's talk briefly about the parts of Medicare. So Part A of Medicare is your hospital insurance. Part B is your medical insurance, doctor's office visits, physician's visits, specialist visits, that kind of thing. And Part D is your prescription drug coverage. Now, I skipped over Part C because Part C is also known as Medicare Advantage. And what it does is it takes Part A, Part B, and most times it will take Part D as well and put it all together into a managed healthcare plan that looks very similar to the classic healthcare plans you've been using your entire life. So Part A covers 80% of hospital insurance. Part B covers 80% of medical insurance, and the Part D drug plan will cover some of the costs that you run into when you get to the drug the drug plan. I'll go over those in detail a little bit further. This is where things get a little bit more tricky. You can decide to do a Medicare supplement, and the way it works is if you look on the left column, you have Original Medicare Part A and Part B. The 20% that Original Medicare does not cover, you're able to cover with a Medicare supplement, also known as Medigap insurance. One thing to keep in mind is Medicare supplements and Original Part A and B do not cover your drug costs. So if you want to go with a Medicare supplement, you will need to get a standalone Part D prescription drug plan. These will run anywhere from $15 all the way over $100 a month. And their formularies vary greatly depending on what medications you will need to get covered. Your other option is to go with a Medicare Advantage plan, also known as Part C. Most of these plans are HMOs, health maintenance organizations, or PPOs, preferred provider organizations. They work very much like classic healthcare, and they usually combine Part A, Part B, and Part D. So if you decide to go with a plan like that, most likely your prescription drug coverage is going to be included in the plan. Looking a little bit closer at Medicare Part A, most people will be eligible at age 65 as long as they've worked 40 quarters, which is 10 years, and paid FICA taxes. Medicare Part A works at any hospital in the United States that accepts Medicare. Your benefits will restart after you're out of a hospital for 60 consecutive days. Keep in mind, if you stay more than 90 days, you'll be digging into your lifetime reserve pool and be paying $658 a day. So you can see how quickly a 150-day hospital stay just on the cost of the hospital would be $49,021 that you would have to pay. There is, however, no maximum out-of-pocket cap with Original Medicare. They will keep paying 80% of your expenses to infinity. Unlike Medicare Part A, Medicare Part B does have a cost sharing involved. In 2019, the premium starts at $135.50, but that could be higher depending on how much income you and your family make. Medicare Part B works with any doctor or facility that accepts Medicare nationwide. So you can go to any doctor in any state, show them your Medicare card, and it'll cover 80% of what that doctor would charge you if he accepts Medicare. The Medicare Part B deductible is what you will pay before Medicare starts covering the 80%. And in 2019, that number is $185. That's the first $185 each year you will pay. From then on, Medicare will pay 80% of any additional charges. If a doctor does not accept assignment, the doctor may charge an excess fee. That excess fee can be 15% higher than the Medicare assigned rate. So in short, when a doctor goes to Medicare and says, Medicare, I will start accepting your patients, Medicare gives them a catalog of procedures that they can charge for. Let's say an appendectomy is $1,000, and that's the maximum he can charge. If a doctor does not want to accept that assignment and charge slightly higher, the highest he's able to go would be $1,150, and you would have to pay for that excess charge. Again, there's no out-of-pocket maximum or cap with Original Medicare Part B. So let's look at the absolute Cadillac of healthcare, also known as a Medicare supplement or Medigap. In order to get on a Medicare supplement, you have to have both Part A and Part B active. You pay a monthly premium for your Medigap policy in addition to your Part B premium. So you'll be paying $135.50 in 2019. On top of that, you'll be paying your monthly Medicare supplement or Medigap premium. These policies do not include prescription drug coverage anymore. They used to back in the past, but those plans are no longer available. The cost can vary dramatically by company and policy and may go up as you get older. You get guaranteed coverage when you first turn 65. From your initial enrollment date, the day that your Part B goes active, you have 6 months to choose any Medicare supplement in your state without answering any health questions. After those 6 months are over, insurance can ask for health questions and can decline your application if they wish. This is called underwriting. The beauty about MedSups is, like Medicare A and B, you have a choice of doctors and hospitals nationwide. Any hospital or doctor that accepts Medicare has to accept your MedSup if they've got room for you. The other thing that MedSups are wonderful for is that the coverage is standardized. Companies can only sell you a standardized policy identified in most states by the letters A, B, C, D, E, F, G, and so forth. The main MedSups you will see these days are Plan F, Plan G, and Plan N. The only difference between Medicare supplements, and this is a very important thing to keep in mind, is the price that you pay for them. They all have to provide the exact same level of coverage, and you can go to any doctor nationwide with any company's MedSup. Let's take a quick look at the most popular MedSups available today. The one that you see quite often is the Plan F. Plan F, you pay your monthly premium, and then 100% of your costs are covered. Anything approved by Medicare will be covered with a Plan F with absolutely no deductible. In 2020, the Plan F is no longer going to be available for people aging into Medicare, and therefore the price is expecting to go up at about 9% per year. Plan G and Plan N are great options, and I'll go over the details of them in a little while, but the expected increase in price, we're looking at about 3% per year. So in most cases, it tends to be the MedSup to go with. Let's take a deeper look at my favorite plan, and that would be a Medicare supplement called Plan G. Original Medicare Part A pays all but $1,364 when you first check into a hospital. This is what you have to pay. Medicare, the Plan G will pay all of that. That's the Part A deductible. Days 61 through 90, Medicare pays all but $341, and Medicare Plan G pays that for you. If you do stay longer than 60 days, that price goes up to $682, and guess what? Medicare pays that for you. And it'll also pay an additional 365 days, 100% of eligible expenses. And the same is true for the skilled nursing facility below. Now let's take a look at the Part B services that are covered by Medicare Plan G. As you can see here, Medicare pays 80% of your costs. The other 20% is what you generally would have to pick up, but Medicare Plan G will pay that for you. One thing to keep in mind is you will be responsible for the first $185 each year before the Plan G kicks in. Once that $185 is met, all your expenses from then on are fully covered by the plan. So you pay your plan premium, and you pay the first $185 each year for your health care outside of the hospital. This is for physicians and specialist expenses and so forth. And once that $185 has been paid, you pay $0 for all Medicare covered services. We've all been told at some time in our lives not to compare apples with oranges. When we look at Medicare supplements, Medigap plans, it's like comparing apples to apples. The only difference between the plan is the price you pay. So in this example, Company 1 through Company 5 all offer a Plan G. Those plans are identical. If Company 1 is Transamerica and Company 5 is Mutual of Omaha, those individuals will have the exact same coverage. They can go to any doctor in the United States that takes Medicare or any hospital that takes Medicare and get the exact same level of service from those doctors and hospitals. Again, the only difference is going to be the price you pay. So it's very important to choose a company that's got a history of low price increases and stability, and that is what we will help you look for. Medicare Advantage can be quite a bit trickier. It's not comparing apples and oranges. In this example, you're comparing grapes to strawberries, to bananas, to oranges, to pineapples. The plans vary tremendously from state to state and even county to county. There are plans available that don't cost you anything on a monthly basis, and there are plans that can cost you quite a bit of money, over $100 in some cases. The thing with Medicare Advantage to understand is they are network plans. So you will be somewhat limited to the doctors and hospitals that you'll be able to see, and the plans will vary tremendously from HMO to PPO. The upside of these plans is that they can be significantly less out of pocket on a monthly basis, and they do have other benefits that Medicare supplements generally do not carry, such as gym memberships in some cases, some dental, vision, and hearing coverage, and so forth. And this is something that we'll discuss with you and see if a Medicare Advantage plan is something that you should consider. And it depends on where you live and how you use your healthcare. Now, if you decide to go the Medigap or Medicare supplement route, you will have to get a standalone Part D prescription drug plan. These plans do all have monthly premiums and in some cases an annual deductible, meaning the first X amount of dollars that you pay for your drugs every year will come out of your pocket 100% before the plan starts kicking in. Plan benefits work off a calendar year, just like Medicare Advantage. They will run from January 1st of each year to December 31st and then automatically renew. All Medicare drug plans, as well as Medicare Advantage plans with drug coverage, use what are called formularies. These are just catalogs of individual drugs that the plan will cover. Each drug is placed in a tier level, tier 1, tier 2, tier 3, etc. The lower tier levels, in some cases, have no copay or very little copay, and as you go up the tiers, the copay gets higher. And we'll talk a little bit further about the donut hole and more complicated things to think about when we have our individual one-on-one. You do have some issues like prior authorization for specific drugs and for specific levels of refills. So if you want a high refill of an opioid, which is a highly controlled substance, you may run into difficulty. There's also a thing called step therapy where many of these drug companies are going to require you to use a generic drug before they'll allow you to use an actual name brand medication. So let's look at the important enrollment dates, and specifically let's look at Medicare supplements or Medigap policies first. As I mentioned earlier, it's important to know that when you first turn 65 or you first get your Part B, you have a 6-month period to get any Medicare supplement in your state, regardless of your health condition. You could be a terminal cancer patient and get a Medicare supplement and get that full coverage in the first 6 months when your Part B goes into effect. After that 6 months, you've got to go through underwriting to be able to get into a Medicare supplement plan. And in most cases, you have to be relatively healthy to qualify. So it's important that if a Medicare supplement is the direction that you're leaning towards, you get that when you first get your eligibility for Part B. With Medicare Advantage, the period for you to enroll is 3 months before the date of your Part B effective date, the month of your Part B effective date, and the 3 months after your Part B effective date. So it's important that you make sure that your Part B is going to go into full effect with your Part A, and this is done by calling Social Security 3 months before your Part A and Part B is due to go in effect. It's only automatic if you are getting Social Security before you turn 65. Other than that, you've got to call them up and you've got to make sure that your Part B is actually going to affect the same day as your Part A. This is very important. So this has been a brief overview of Medicare. Understand that there's so much more that we'd like to talk about with you and your specific needs. Please feel free to click on the link that we sent you. Nell and I are here to speak to you and help you through making the right decision. Again, I'll just reiterate that we do not get paid by you. Everything you do with us is 100% free to you. We will help guide you to the right company, whether it's Medicare Advantage or Medicare Supplement in your area, and we look forward to working with you year after year. Thank you so much for your time.